name is Josie Munene, and I am a certified lactation educator and the Director of Community Engagement at Maziwa Breastfeeding. Okay, so I've been doing this for about, I realized 11 years now, so over a decade. I started off because I struggled with breastfeeding my own, especially my first two children. And I realized that there was a gap in Kenya, not across the world, because when I did my research, I found that actually lactation consultants existed, breastfeeding support counselors existed, especially in the US and the UK. So that prompted me to find out, how can I close this gap? How can I make sure that other moms don't have to suffer? Because our nursing, our primary healthcare professionals are not necessarily well skilled in the support part, the lactation support area. So they have the technical knowledge, they know how lactation works, they know how breast milk is made and how it is removed by putting the baby on the breast. But there's a huge gap there as to supporting mothers to help them have a positive experience of breastfeeding, so that they don't have to encounter the challenges of, cracked nipples, mastitis. Those challenges can actually be, they don't have to happen, and they can easily be overcome if they have the right amount of support. And over the last 10 years, I've seen a huge shift now. Not only is my profession now being recognized in Kenya, because it has not been recognized, but most importantly, mothers are now reaching out. They know they don't have to suffer in silence. They know that the myths and misconceptions around breastfeeding that can be cultural and traditional based can be overcome with the right amount of evidence-based knowledge. So I've seen a huge shift. And I think for me, what I really want to see more is more multidisciplinary teams being formed to support a breastfeeding mother. So you have a pediatrician who refers a mother to someone like me, and then we work together to help her overcome her challenges, and vice versa, so that there's holistic support for the mother-baby dyad. I think the most significant challenge is where mothers can be able to pump, given the utilities available to them, especially electricity, because most traditional pumps ask for a mother to be able to connect, plug into a wall socket, because it's not portable. So the fact that this is portable and this is rechargeable means that a mother can wear it. So again, it's discreet, but most importantly, she doesn't have to be seated next to a power outlet in order to use the pump. So that means that even if she's at home, she can always continue with her chores as she's pumping. But most importantly, if she's in an office and there's no designated space for her to express milk, then it means that she can find a quiet and private space, whether it's at a corner or anything like that, and she can be able to actually express milk very discreetly because she's wearing the collection cups, compared to the other traditional ones where you have to have a special bra, the bottles protrude outside, which means you have to be exposed, your chest has to be exposed. So in this case, you can sit in a corner, it's very quiet, the motor is also very quiet, and a mother can express very easily at the office. She doesn't have to do it at the desk if she doesn't want to, but neither does she have to do it in the toilet, which is the most important thing. So that is I feel the biggest challenge that the Wema is helping mothers to overcome is the idea of they don't have to be seated next to a power source. And most importantly, they don't have to expose themselves in order to express milk. I think anybody who is able to support and wants to support breastfeeding, and that includes all the key actors. So even employers, the health level as well, because if you have employers who are able to give their employees access to something like this, again, because of the fact that it is so portable, it means that an employer can actually, all they need to do is perhaps purchase this for their office, regardless of the size of the office, so they can say maybe we'll have one for each department or one floor, and then have their mothers purchase this, because now this is the one that is single user. So this can only be used by each single mother. So if an employer is able to do something like that, already they're encouraging a mother to come back to work, to continue expressing so that she can meet her goals of exclusively breastfeeding. Because in Kenya, we have 90 days of maternity leave, which means you're still left with an additional about 90 days for you to complete your exclusively breastfeeding journey. And then, of course, when it comes to, again, the medical profession, them being able to recommend a pump like this, instead of telling them, oh, at 4 months, you can just start on cow's milk or whatever it is. Again, just them being able to say, actually, there is a pump that can help you. You don't have to just, if expression is not something that you're familiar with, use this pump and you'll get the support that you need to be able to use the pump. So yes, definitely outside of mothers themselves, there are a lot of other key actors who can support the use of the pump.